Hi, and welcome back to In the Gray Area with REVV Health. I'm Brittany.
And I'm Travin.
And today we're going to dive into all of the misinformation in regards to thyroid hormones and also kind of talk about the benefits and how to go about optimizing your thyroid.
Yeah, I love talking about thyroid hormone. And like for anyone that's listening, like I kind of went into my story in, I think, episode 1 about when I was diagnosed with Hashimoto's and spent literally like almost a decade, bouncing around with different doctors and trying to like get my thyroid situation figured out. But it's one of the things that I think, aside from testosterone, probably maybe even more gets either misdiagnosed or just gets missed altogether in, kind of like the Western medical community. We see so many people with, thyroid insufficiency or suboptimal thyroid. And it's one of those things that, like testosterone, it can affect so many things, including just like your mood and your energy levels and kind of sense of well-being. And so it's like, as we age and people kind of have those feelings of like feeling off and fatigued and not feeling as good as they used to, like thyroid is just as important as testosterone when it comes to like optimizing.
Yeah, I think what's really sad too is when people come into us and they aren't even testing for their active thyroid hormone. So they're coming in and then they're telling us, well, my thyroid is normal. Like my doctor said it's normal, but they're being put on all these antidepressants.
Yeah. Yeah. That's it. It drives me crazy because like in kind of the standard of care is that if you're evaluating someone's thyroid, your provider is going to pretty much check your TSH, your thyroid stimulating hormone. And that would be the equivalent of like, if I'm a guy going in to get evaluated for testosterone and the doctor just checking my luteinizing hormone, but not checking my actual testosterone levels and then trying to determine if I have sufficient enough levels. So like your TSH isn't even a thyroid hormone. It's not produced by your thyroid. It's purely a signaling hormone produced from your pituitary. So it doesn't even tell us how much thyroid hormone we're producing at all.
Yeah.
So, but that's all they use to typically make a diagnosis of, is your thyroid functioning okay? And so that's where, going back to what you said, that's where people come in and they say, oh, my thyroid's fine, because they looked at their TSH. But like we know, then we do our thyroid panel and we see like, okay, yeah, you have a middle of the range TSH, like it's quote unquote normal, but your T3 is like in the gutter or it's the very low end. And we know that like, that's the hormone that matters.
That's your active thyroid hormone.
Yeah.
Yeah. And a lot of times doctors don't even run your T3.
They won't run it at all. I think, I'm pretty sure about this. Like, I don't think insurance even covers testing like free T3. I think that's why a lot of people don't even look at it, which is unfortunate because like that's the active thyroid hormone and that's what controls everything.
Yeah. I think a lot of times people aren't even aware that like some of the side effects or like symptoms of low thyroid kind of mimic low testosterone as well.
Yeah. Oh, yeah. Pretty much. I mean, they pretty much 100% overlap of symptoms. And so I think we talked about this, I don't know, in one of the other episodes, but that's why, a lot of guys will, if they don't respond well to like just testosterone, if they're on testosterone therapy and they're still not quite feeling the way they should, a lot of times it's because they have, suboptimal thyroid function and that's not being addressed.
So some of the signs that your thyroid may be suboptimal would be like fatigue, weight gain, even like constipation too.
Yeah. I mean, we see that a lot. People don't realize or make the connection, but definitely
depression,
cold body temperature, libido, erectile dysfunction even can be affected by thyroid, like hair falling out or hair thinning. Hair, that's another big one. So there's a ton of, it's probably like 50 different symptoms of like low thyroid. I mean, there's a lot of them, but those are kind of the big ones. But
yeah. And I think that there's so much misinformation out there. Like people are scared to take a thyroid supplement as well.
Yeah. Yeah. Just like every other hormone. They're scared too. But like what, like you had mentioned earlier that people being prescribed kind of the wrong medication. And, typically if someone does, like if they do get the diagnosis of like Hashimoto's or hypothyroidism, typically they're given a T4 only drug like Thyroid or levothyroxine. And the problem with that is then you're relying on your body to convert the T4 into the T3 active hormone. And as we see, like with most Hashimoto's patients, like they do a very poor job of doing that conversion anyways. And so you're giving them a T4 only drug that is going to shut down their thyroid. So it's going to shut down any sort of like endogenous T3 production that they have. So they're purely relying on their body to convert it, which it doesn't. So it actually pushes a lot of them even more hypo than they were to start with, which is why a lot of people end up feeling worse after they get put on those medications. And usually the response to that is, well, we'll just give you more of it.
Yeah.
Yeah. So like what we use is a natural desiccated thyroid, which has been used for literally like hundreds of years. with a lot of success.
Yeah. And we see amazing results with it too, but kind of overcoming that too. So a lot of times I know that when we do labs, like always, everybody wants to know the number.
Yeah.
And that's a hard one too, because everybody's number is going to look different.
Yeah.
And I think people get really scared when they see their labs and like their T3 especially is like in the red because it's high. So kind of like maybe you can explain a little bit on like how safe that is.
Yeah. Like, I mean, as far as I'm concerned, like you want it in the red, like you want it to be above the normal range. And, you know, not to say that everyone has to be above the normal range. I mean, there's plenty of people that are on the high end of the normal, like, you know, 4 to 4.5 level of T3 that do great, but many people need well above that. You know, and if you look at lab work from like a young, healthy athlete, they're going to have a T3 that's well above the reference range, you know, and like, that's what we want. That's what we're shooting for is like optimal levels of these hormones. And so, yeah, it's going to be red, you know, your TSH will be suppressed when your thyroid's optimized. Like that is to be expected, just the same way that like your LH and FSH are suppressed for a guy when you're on testosterone therapy. Like we understand that. And so,
but a lot of times doctors don't understand
and that's what I was getting to is like, people will have come to us and it's like, as much as we say, like, don't involve your primary care doctor in your hormones. Don't have them test your hormones because they're going to see these things and they're going to freak out. And like, how many times have we heard that like, oh, my doctor said you're causing me to be hyperthyroid.
Yeah.
You know, and that's just a lack of understanding, like how optimizing these hormones work. You know,
well, even Lisa's talked about that, like on our podcast with her, she talked about how overcoming some of the stuff that she was taught, how difficult it's been. And sometimes she still gets sucked into that. And she's been through training. So
yeah. Yeah. It's like, I love her perspective on it because I love that she's, you know, she was in, you know, Western medicine for 25 years. And so she saw like how frustrated she became with like not being able to like improve outcomes. And like, that's what it's all about. But it's like, you're so stuck in this like window of like things that you can do that aren't actually really helping people. You know, and so I think like she, you know, learning what she's learned and then seeing the improvement that we have on our patients here, like has been super rewarding to her, you know, just like it is to us.
And like anything else, it's one of those things that you have to be patient with and everyone's different. So explaining to people that, you know, it can take a few months to really like get to your dose that works for you is really, really important. I think that people get frustrated. Initially, when they start, they feel good and they have energy again, which is wonderful. But then they'll kind of like plateau a little bit again. And we kind of have to reevaluate because everything is working together and remembering that you didn't have these hormones for a long time.
Yeah. Well, it's all very nuanced, you know, and it's like these levels and how we feel, like it's all very fluid. And so it's like, just because like you could go, you know, a year or 2 years or like, let's say several years on like a certain dose and regimen of hormone therapy. And then, you know, over time, like that might not always work for you. And there's going to need to be like adjustments made, like your body changes, your metabolism changes, like things change. And like, so your dosing and things need to change. So it's like, you do have to understand that like, just because something's working now doesn't mean it's always going to be working.
Right.
Yeah. You know, one of the things that I think is so frustrating, like going back to how there's such a lack of optimizing thyroid hormones because there's this fear of, like we said, people becoming hyperthyroid, which you don't make someone hyperthyroid by optimizing their thyroid hormones. But like, let's look at like the use of statins, for example. Like statins are the #1 prescribed drug in the US. And we can see from all of the medical literature that they lower cholesterol numbers on paper, but they don't actually improve health outcomes versus something like if you optimize thyroid, like that's one of the best tools at improving cholesterol profiles is optimizing thyroid, but it's never used for that. And there's such a fear of using it, but like we have no problem like handing out statins like candy that are going to lower testosterone levels. They're going to increase insulin resistance. They're going to increase your chance of, you know, diabetes and cardiovascular disease. Like it's such a backwards system that we have.
And it makes you wonder why.
Yeah. Well, it's driven by big pharma and money. I mean, it's like people need to understand a lot of the education that these providers receive is driven by big pharma. And it's purely a way to like sell more drugs, not necessarily improve outcomes.
Yeah.
You know,
sad. Yeah, recently we had the one patient that in the beginning she came to us and she was already having heart palpitations without taking anything, which is something we see very rarely. And it was amazing that within just a few days of her starting that, like she hasn't had any heart palpitations at all anymore.
Yeah, thyroid actually improved it.
It did.
Versus, that's a lot of the fears that it's going to cause things like that. Yeah.
Yeah. But we do have to be careful. We go slow. We start at a very like moderate dose because everybody's different. And some people don't tolerate it very well. So
some people don't. I would say they're the exception more than the rule. Like it's just like testosterone, like we talk about. Like if you give a man too little testosterone, you're going to make him worse. Right. And it's the same thing with thyroid. Like if you give someone too little, you're going to shut down natural production, and then you're not giving them enough to overcome it and then optimizing those levels. So you do have to focus on optimization. But like you said, some people are ultra sensitive to it, and you have to kind of do things a little bit differently.
Yeah. We have a lot of patients that are like dealing with autoimmune and stuff. And by optimizing their thyroid has really improved some of their symptoms that they have from that too.
Yeah.
Which is pretty cool.
Yeah. Again, it all goes back to like the insulin resistance and the inflammation that, all of these hormones help to reduce.
Yeah. And then we've got, again, like we always talk about, we've got all these girls with PCOS. And so addressing their PCOS with first progesterone and then thyroid, the two together is an amazing combination.
Yeah. And even, young women, like we've been able to work with so many young women that, how do we put this? Like working with like a primary care provider, like would never have the opportunity to kind of optimize some of these hormones in the way that we're doing to kind of control or help some of the PCOS symptoms.
Well, especially with mood and depression and irritability. Like we have so many young girls now with horrific like cycles that they're going through. And, outside of just like the heavy bleeding, we've got the even like the mental illness that's coming with it and the depression and anxiety.
Yeah.
So it's pretty amazing that we can use some of these hormones to help them as well and get them off of those.
Yeah. Most people probably have no idea that like thyroid is used a lot in psychiatry. Like high dose thyroid supplementation is used to treat depression, and so it's like that, like if you look in the psychiatry world, like they'll use ultra high doses of thyroid, things that like the Western medical community would think is crazy, but like they know something that a lot of these other doctors don't know in terms of like how these hormones affect, your brain and your mood and fighting depression. Like it's pretty cool. There's a lot of cool literature in the psychiatry world about it.
Yeah, absolutely. And then even with reproduction, there's so many studies on the benefits of having an optimal thyroid before getting pregnant, during pregnancy, and even like the health benefits for baby. So that's pretty incredible. I don't think a lot of people are aware of that.
No, we've actually even heard people say the opposite from their provider, like that they would like
take them off,
remove them from these hormones like during pregnancy.
I know, it's sad.
Yeah.
Yeah. I think a lot of times too, like especially with our females, we'll hear a lot of issues with like skin, hair, and nails too when they come to us. And that's kind of something that even takes definitely more time, I think. And it could possibly even get worse before better.
Well, you know hair a lot better than me, but isn't a hair cycle like 6 months?
Yeah.
Or something like
There's
that?
three different stages.
Yeah. So it's going to take a minimum of 6 months to notice the changes like in hair?
Yeah. I would say for myself, especially, it took some time to get to that optimal level and like dialing in my dose. And I even had to move up from once a day to twice a day. And that made a huge improvement. Yeah. But a full year, now I can tell tremendously in my hair and skin and nails, all of them.
Yeah. If you want to like significantly move like metabolic markers, like doing your thyroid dosing twice a day and like really optimizing your dose, like that's going to help tremendously. Like we see that on paper and then we see it play out all the time.
Yeah. And it does eliminate that crash that a lot of people get, like, around 3 o'clock in the day.
Yeah. I mean, women, like I love thyroid. I think, overall, like women tend to feel it a lot more than men do. Kind of like, women feel thyroid kind of the way that I think men feel testosterone. Like it's such an uplift in like your mood and energy for women.
Yeah, most definitely. Especially even, I want to say postpartum, but honestly, at any age, it's so beneficial.
Yeah.
We've had, like younger girls that have got on it, like I said, getting off of their antidepressants and stuff. But then we've seen even like from the ages of 19 to 22 with severe PCOS and getting on it. And it clearly helps with mood and energy.
Yeah. Yeah. It's amazing.
It is amazing.
Yeah. Thyroid and testosterone in combination is fantastic.
So we've kind of tackled a little bit about some of the like side effects of having a low thyroid. I think a lot of times people also come to us and they want to know like if it's dangerous. We kind of touched on that a tiny bit, but could you explain a little bit further on the safeties of it?
So a lot of the, fear about thyroid being dangerous stems from people who are hyperthyroid, right? So when we say hyperthyroid, we mean like they produce too much thyroid hormone. But what we know, like from the medical literature, hyperthyroid is caused by underlying Graves' disease, which is another autoimmune condition. The danger of having, excess thyroid hormone, or what we perceive as that, it's actually not the thyroid hormone that's causing the danger, it's the underlying Graves' disease. And we know that because in the medical literature, like they completely remove the thyroid. So there is no more thyroid hormone being produced, but the Graves' disease still progresses. The disease state still progresses. The symptoms still progress. So it's not the thyroid hormone that's causing the danger, right? It's the Graves' disease. So same thing when we look at like treating thyroid and optimizing thyroid, like there is zero evidence in the medical literature at all that says that, any sort of amount of thyroid hormone is harmful.
Yeah, that's crazy. They would remove the thyroid.
Yeah, and the disease still progresses. All you, guys and girls listening, like thyroid hormone and thyroid optimization is super important to optimize, but it's one of those things that gets overlooked so much. So like for women, especially you're going to see it with like weight gain or even like inability to lose weight is a big one. Fatigue, especially like later in the daytime fatigue, like that's going to be a big sign. And then guys, like, same symptoms of like low testosterone. And if you are on testosterone therapy and still not like having symptom relief, like take a look at your thyroid, because that's probably going to be like one of the big reasons why you're not getting that complete symptom resolution.
So for any of you listening that are experiencing any of these side effects of suboptimal thyroid, I'd really encourage you to reach out to somebody and get your thyroid tested. Even if it's not with us, just make sure that they are testing for all of your active thyroid hormones as well. And thank you for tuning in, and we will see you next time.